The IMPACT AF study is testing the use of a clinical decision support system in community-based management of atrial fibrillation. The Clinical Decision Support System, or CDSS, is an online tool that has computerized clinical guidelines for atrial fibrillation management and offers patient-specific, evidence-based recommendations and point-of-care decision support. The overall goal of the study is to improve patient outcomes. The CDSS will help simplify and prioritize patient care needs by monitoring changes in health status and alerting the care provider of any available options to enhance care based on best practice guidelines. This video will demonstrate some of the basic features of the CDSS. The first screen you will be presented with when you log in is the CDSS dashboard. On the dashboard, you can see a list of patients who have consented to participate in the study. A study abstractor has populated each patient's profile with relevant health data from the past 3 years. On the right-hand side of the page, you can see graphs presenting a combined survey of the care provider's study patients. The bar graphs can be clicked on to reveal the individual patients in each category. To look at an individual patient, you can click on their name. You'll notice that the combined summary graphs have been replaced with information about Jane Doe, including automatically calculated stroke and bleeding risk scores. By clicking on a risk score, you can see which elements are present according to that risk tool. The CDSS will automatically recalculate these scores over time whenever a new piece of health information is received. A key feature of the CDSS is the care recommendation or alert feature. The column marked A indicates if the CDSS has generated care recommendations for this patient. If the recommendation is considered to be of high priority, you will see a red flashing beacon to the left of the patient's name. An orange ball indicates there is a moderate priority alert present. Let's look at a high priority alert. Jane Doe is 67 and was recently diagnosed with atrial fibrillation, so not yet on antithrombotic therapy. According to the clinical guidelines, an OAC or NOAC is recommended for all non-valvular AF patients who are 65 years of age or older. This is a high priority alert given the potential risk of stroke. Now let's look at a medium priority alert. Jane Doe has been started on warfarin as recommended. Over the last few months, Jane's INR has been within range, so her warfarin dose has been pretty stable. However, this month, when she went for blood work, her INR was 3.6. The CDSS has detected that Jane's INR is above the target range and as a result has suggested that she should hold up to 1 dose of warfarin and decrease her weekly dose by 10 to 15% and that the INR be rechecked in 1 week's time. This recommendation is based on the QE2 anticoagulation clinic nomogram. You may visit the alert page for each patient by clicking on the corresponding number next to their name. Here, you are presented with all of the care recommendations that have been generated based on this individual patient's profile. You can review an alert by clicking on it, which will reveal the priority level, care recommendation, and the reason the alert was produced. There are 3 options for responding to an alert, which will clear this alert from your dashboard. Accept indicates that you agree with the finding and will proceed with the care recommendation. Override indicates that you either do not agree with the finding, for example, there was an error in the recording of the patient's medical history, or that you will not be following the recommendation, for example, if the recommendation goes against the patient's wishes. Ignore indicates that you see the alert but will not be following through with the care recommendation at this time. When you accept an alert in the medication category, a pop-up box will be presented asking if you would like to go to the medication page where you can add, delete, or make changes to the patient's current medication profile. If you would like to use the CDSS to help you with warfarin dosing and INR monitoring, you can use the warfarin dosage calculator to figure out the new recommended daily dose. If the CDSS presents a NOAC recommendation, you will be able to use the NOAC authorization tool to quickly populate and print out the Nova Scotia Special Authorization Form. The CDSS also offers guidance on how to switch from warfarin to a NOAC and provides NOAC medication dose recommendations and contraindications based on creatinine clearance. We hope that you have enjoyed this brief demonstration of a few of the key features of the IMPACT AF CDSS. If you are interested in learning more about the study or any of the additional features offered, please check out our other videos or contact the study office for more information.